In getting treatment for Hodgkin's lymphoma, you're receiving usually chemotherapy or radiation, and those treatments are used to treat a lot of cancers, especially cancers in older patients. The problem is that chemotherapy and radiation have a lot of side effects down the line that those older patients may not live to see. But Hodgkin's lymphoma can affect a lot of people who are younger, like me. I was in my 30s when I was diagnosed, and I know many people who are even younger than me who have it. And we will live, well into our 50s, 60s, 70s, and beyond. And so there's a risk for secondary cancers developing from the use of chemotherapy and radiation at a young age. For me, those included mouth cancer, tongue cancer, things associated with my lymph nodes and my head, because that's where the cancer was and where the chemo was concentrating itself. For other people, it can be other forms of cancer depending on where the Hodgkin's presented itself. But basically, there are secondary conditions that could develop further on down the line that stem from the treatment that you're having now. That doesn't mean you don't want to get the treatment now, because obviously the cancer will kill you if you don't get the treatment, but it is something to be aware of. And that's why frequent checkups are necessary probably for the rest of your life, just to stem the tide of anything that might develop from your chemo treatment.